If you're over 50 and dealing with joint pain, you've probably taken ibuprofen, maybe for years, and lately you've probably seen CBD everywhere. Oils, gummies, creams, all claiming to reduce inflammation naturally. So here's the real question. Is CBD actually safer than ibuprofen after 50? Or is it just a trend? Today, we're comparing both. Side effects, long-term risks, benefits, and when each one actually makes sense. No hype, just facts. Let's start with ibuprofen, because most of us already use it. Ibuprofen is a non-steroidal anti-inflammatory drug, an NSAID. It works by blocking enzymes called COX-1 and COX-2. Those enzymes produce prostaglandins, chemicals that promote inflammation and pain. So when you take ibuprofen, you're directly blocking inflammatory chemicals. That's why it works quickly, often within 30 to 60 minutes. For short-term pain, it's very effective. But after 50, the conversation changes, because long-term NSAID use carries real risks. Here's what many people don't realize. As we age, our bodies become more vulnerable to NSAID side effects. Let's break down the big three. Number 1, stomach risks. NSAIDs reduce protective stomach lining. That increases risk of stomach irritation, ulcers, internal bleeding. After 60, the risk of GI bleeding rises significantly, especially if combined with blood thinners or aspirin. Number 2, kidney risks. NSAIDs reduce blood flow to the kidneys. Long-term use may contribute to reduced kidney function, fluid retention, increased blood pressure. If you already have mild kidney decline, common after 50, NSAIDs can worsen it. Number 3, heart risks. Some NSAIDs are linked to increased risk of heart attack, increased stroke risk, elevated blood pressure. The risk is higher with long-term high-dose use. Now, this doesn't mean ibuprofen is dangerous for everyone. Occasional use at recommended doses is generally safe for healthy adults. But daily chronic use, that's where risk accumulates. So now let's compare CBD. CBD works differently. It interacts with your endocannabinoid system, which helps regulate pain, inflammation, mood, and sleep. Unlike ibuprofen, CBD does not directly block inflammatory enzymes. Instead, research suggests it may modulate immune response, reduce inflammatory signaling, influence pain perception, calm nerve sensitivity. It tends to work more gradually, often over days or weeks, not hours. And its effect tends to be milder than NSAIDs, so it's less aggressive. But that also means fewer severe side effects for many people. Let's compare directly. Ibuprofen. Common side effects: stomach irritation, heartburn, elevated blood pressure, kidney strain, bleeding risk. CBD common side effects: drowsiness, digestive upset, dry mouth, fatigue. CBD does not carry the same ulcer or bleeding risk as NSAIDs. However, and this is important, CBD can interact with medications. It affects liver enzymes that metabolize drugs. So if you take blood thinners, heart medications, anti-seizure drugs, multiple prescriptions, you should speak to your doctor before using CBD. Neither option is risk-free. They simply carry different types of risk. So when should you use ibuprofen? Ibuprofen makes sense for acute injuries, flare-ups, short-term inflammation, situations where you need quick relief. It's powerful and fast-acting. Now, when might CBD make sense? CBD may be helpful for chronic low-grade joint pain, ongoing stiffness, sleep disruption from discomfort, people trying to reduce NSAID use. It's generally better suited for consistent, long-term management, not emergency pain relief. For some people, the best strategy is occasional NSAID use plus daily lifestyle support plus possibly CBD. Movement, strength training, and weight management remain the foundation. No supplement replaces that. CBD will not eliminate severe arthritis pain overnight. Ibuprofen will not fix the underlying cause of joint degeneration. Both manage symptoms. The key is using the right tool at the right time and minimizing long-term risk. After 50, safety matters just as much as relief. So which is safer after 50, CBD or ibuprofen? For short-term use, ibuprofen is effective and generally safe. For long-term daily use, CBD may carry fewer serious organ-related risks, but still requires medical awareness. The smartest approach? Informed decisions. If this comparison helped you, subscribe for more practical, science-based health insights designed for adults over 50. And let me know in the comments, which one have you tried? I'll see you in the next video. Please like and subscribe and check out our products in the description.